Hi. April is STD Awareness Month, and I thought as a specialist, it's important we discuss this. We live in a country where discussing reproductive or sexual health issues is considered taboo, and many of us have not received proper sex education in the schools. Hopefully, this will change with the years to come. So, we receive a lot of patients who are sexually active across all age groups, from teenagers to elderly patients, females, males, transgenders, and most of them are hesitant or reluctant to come out with their genital issues. So, what is an STI? An STI is a sexually transmitted infection. It is an infection which spreads by sexual contact and it can affect the genitalia or any other organs in the body. It may or may not always present as a symptomatic clinical disease initially. So, whether it is caused by a bacteria, a virus, a fungus, or a parasite, there are certain practices which can facilitate the spread of this kind of infection. For example, having multiple sexual partners at one current given time can increase the chances. Unprotected sexual intercourse, insertive or receptive anal sex or oral sex, certain practices like sex during the menstruation or vaginal douching or improper genital hygiene measures can also facilitate the spread of STDs. So typically, how does a symptomatic clinical STD present? A person can either have genital itching, they can have burning, or they can have ulcers in that area, they can have swellings, redness, painful sexual intercourse, discharge at that area, lower abdominal pain. So, and very often they may not even have any symptoms. But why is it important to not overlook this? Why is it important to always make sure you get a checkup? Very often, STDs can give rise to complications such as infertility. It can spread to other organs. It can lead to changes in the anatomical structures of the genitals. It can also, depending on the cause of the STD per se, it can also have oncogenic potential, meaning it can give rise to cancers of the cervix, the vulva, the vagina, the anus, and the penis. Say it is to recur or occur at the time of pregnancy, it can give rise to complications in that in both the mother as well as the baby. It can also lead to a lot of psychological distress in an individual. Another reason why it's important to actually get a checkup is because sometimes it may not even be an infection. Not everything which affects that area is an infection. For example, it can be an autoimmune condition, it can be a systemic or a psychological condition affecting that area, or an allergy to drugs, or to say sanitary pads, to undergarments, to the type of condoms being used, to the vaginal washes being used. Or it could just be a normal physiological condition which actually is nothing to worry about. So it's always better to get it checked. So I leave you with the ABCDE of STD prevention. A is abstaining from unprotected sex. That is, of course, unless you're planning a pregnancy. B is to always be faithful to your partner. Avoid multiple sex partners at any given time. C is condom usage. Now, condoms or barrier contraceptives, especially polyurethane and latex ones, will prevent against a wide range of pathogens. Other contraceptives such as microbicides or spermicides in the forms of foams, jellies, films, and suppositories would also aid in the same. C is also for circumcision. It's scientifically proven that men who are circumcised have a lesser chance of getting these STDs. D is for doctor consultation and detecting it early. It is actually recommended internationally to get pap smears, that is to detect early cervical cancer after 21 years of age. In India, it is from the age of 30 to 65 every 3 years. It's ideal to get a pap smear done. E is to educate yourself. Be more aware of your genital anatomy, of reproductive and sexual health. For example, the HPV vaccine or human papilloma virus vaccine, it is to prevent warts and cervical cancer. And it's a 3-course vaccine which should be given to girls as well as boys, which a lot of people do not realize, between say the ages of 9 to 26. And it's always ideal to get yourself vaccinated before you become sexually active. Thank you.